Grant, thank you for joining us. How does it feel to be back? How is it different? And perhaps most importantly, how did you and your institution prepare both yourselves and your patients for resuming surgery in the middle of COVID-19?
Yeah, thanks, Rob. And it is nice to be back operating again, but I think, as I'm sure people have kind of reinforced, it has to be done in the safest possible way and make sure that there's a process in the hospital, in the clinic, for the patient to be able to understand everything to keep not only the patient safe, but the provider safe. So this timed out perfectly. Got 3 cases done this morning and several more to go. But when to kind of build on Bill's point, the patients I'm operating on today are severe arthritis. They would not call it elective. They've been suffering. They're at home stuck in a chair. Can't get outside even if they wanted to. And so they're the ones that are kind of in the severe category that's really disabling pain. But I think that as far as experience on when I'm talking to my patients down in Mobile, on the southern tip of Alabama, we've been fortunate to not have a huge inundation to our hospitals. We do have cases, but we were able to flatten the curve and prevent the numbers that everyone was predicting. But I think it's a conversation with the patient that really has to continue. So I kind of took a strategy of, during the time off, telehealth so quickly became an option that all the insurances were covering, no copays, everything else made it very easy to stay in touch. So I talked to every single patient that was delayed. I had about 60 or so, and I just kind of talked with them every 2 weeks and said, here's what we're doing, here's the status right now. And the first couple of times it was, we're not ready. And now there's 4 hospitals in our area, and this is the one hospital that's reopened so far. The rest are following in the next week to 10 days, but everyone's been tested. Every patient, every employee in this hospital, every provider. You can't come do a hip fracture if you haven't had that swab shoved into your pituitary gland. I'm telling you, I mean, I had a tear coming down my right eye. I mean, I was crying in the hospital when they did that thing on me, but I felt good about the sample they got, I'll tell you that. But, luckily it was negative, but that makes me feel a lot better coming in the hospital. And I think that it used to be, you worried if you got, as a doctor, got something and a bug, you're out a few days. You get this, you test positive for a month, even after your symptoms are gone. After the month we just had, you add another month on top. I mean, it's a tough day for some of us. So I think prevention is critical, and you don't want to jump back in and all of a sudden you get a few days of surgery and then you're out for a month. So as you can see, we got masks everywhere and all sorts of protocols, no visitors for the family. I've got phone numbers and talking to family members before and after. But as far, I think the biggest thing I'd like to get across is keeping in touch with your patients yourself. We found with some of the other doctors who have their scheduler call, the patients don't feel as connected, and the chances that they feel comfortable going back, because maybe your scheduler may not know every single thing that's going on, and to hear it directly from you, all the safety measures that are put in place, and to hear that, listen, I'm in the same boat as you, neither of us wants to get this thing, but at the same time, your hip arthritis is disabling, you're in a wheelchair, and you're 47 years old. And so we got to kind of make a decision here. But, and I kind of mentioned optimizing the patient during this time off, making sure that, hey, your A1C last time we checked it was 7.4. Let's not stay next to the Cheetos and the Mountain Dew, because like everybody, I mean, that your refrigerator is real close in quarantine. So you got to continue to give them that pep talk on managing their comorbidity issues if they have any. But some of the Medicare patients, older patients, those are being kicked down the road a little bit. If they've got, moderate to severe symptoms that are disabling, but they're able to tolerate it okay, they're not doing very much right now. So their pain is not killing them. I think that those are the patients that are going to move into June, July, and see that hopefully these numbers continue to decrease. But as this kind of time is winding down for all of us, continuing to optimize ourselves. And, Lowry's the president of an awesome organization, ACUS, which puts out some amazing research. And the journal articles, I just kind of eat those up with the spoon. I mean, it's just so amazing to get that world-class data. And I'll be honest, I don't get to read every journal every month, but there's no excuses this last month. I mean, we've all had the time to be able to dive in and really kind of reinforce everything we're doing, or maybe make some changes or improvements. So I think that's really good. But I think the biggest thing I'm trying to get across to my patients is we're all on the same team here, and we're committed to getting you better, but only in the safest possible scenario. If you don't feel comfortable, it's not time. But I want you to know, based on the hospital I'm operating at, where every human gets a temperature check before we come in and has had a recent swab within the last 2 weeks and a negative test, that we feel like we're taking every precaution that's possible out there, but no visitors, everybody's got the masks and everything else on. So I think we're doing the best we can, but it's tough to armchair quarterback this thing because it changes every day. So I think we just kind of get the data we can, reevaluate.
Absolutely, absolutely, Grant. That you had me chuckling a few times there. That was pretty good. But what's wonderful about that presentation, Grant, is you bring us all back to the fundamentals and the fundamentals of working with our patients and just doing the best we can